You're watching the news from the Sultanate of Oman television. His Majesty Sultan Haytham bin Tariq sends a couple of condolences to His Highness the Emir of the State of Kuwait on the death of Sheikh Nasser Fahad Sabah Al Nasser Al Sabah. And the National Oncology Center of the Royal Hospital launches the technique of microscopic radiosurgery to treat cancers. Good evening. Live from this news center of the Sultanate of Oman television, here we present to you the details of this news bulletin. His Majesty Sultan Haytham bin Tariq has sent a cable of condolences to His Highness Sheikh Nawaf Al-Ahmed Al-Jaber Al-Sabah, Emir of the State of Kuwait, on the death of Sheikh Nasser Fahad Sabah Al-Nasser Al-Sabah. His Majesty the Sultan received a cable of thanks from His Excellency President Abdel Fattah al-Sisi of Egypt in reply to His Majesty's cable of greetings on the anniversary of the revolution of the 23rd of July. And His Majesty received a cable of thanks from His Excellency President Ram Nath Kovind of India in reply to His Majesty's greetings cable on the 74th anniversary of his country's Independence Day. Here in the Sultanate, the National Oncology Center of the Royal Hospital launched the technique of microscopic radiosurgery to treat cancers that have spread to the lung, liver and spine, as determined by the supervising medical staff. The delivery of the new technology called stereotactic body radiation therapy aims at promoting patient response to treatment and minimizing patients' pains experienced in advanced stage tumors, in addition to improving the quality of patients' life and their engagement in basic daily activities. The procedure is enhancing the effectiveness of conventional treatment. It pinpoints the exact location of a tumor so that the radiation can be more precisely delivered to cancer cells in a way that minimizes damage to healthy tissues. The Minister of Health announced that total number of COVID-19 cases registered in the Sultanate reached 125,326, while the total number of deaths reached 1,454. The total recovered cases reached 116,720. The Ministry indicated that the total number of inpatients reached 143, of which 72 are in intensive care units around the Sultanate healthcare institutions. A ceremony took place this morning at the conference hall of the National Bank of Oman headquarters to honor Minister of Health teams who worked on leadership and decision-making book and the privilege initiatives of the annual leadership. More details in the following report. The Ministry of Health honored today the teams participating in the two projects, the Leadership and Decision-Making Book and the Privileged Initiatives of the Annual Leadership Forum 2017-2018. These projects are incentives for innovation among the ministry's staff in all organizational divisions to provide their ideas and initiatives that contribute to improve their performance. In this regard, His Excellency the Minister of Health praised all projects of the Ministry of Health that promote the administrative and medical staff. He stressed that no institution could succeed without wise and empowered leadership. In addition, the Minister of Health pointed out that the Leadership and Decision-Making Book will not be restricted only to the health sector workers, but also to the various government and private sectors. Dr. Darwish Al-Maharbi, member of the State Council and the initiator of the project, applauded the role of all the team members and the Minister of Health for supporting these projects. Al-Maharbi affirmed that the book, which worked on for 8 years, addressed the leadership requirements and components.
This is an opportunity to say thank you to my colleagues who have spent a great amount of time and effort and dedication, perseverance, diligence with which they carried out the big task of investigating this very important issue, leadership and decision making, not theoretically but empirically, by delving deeper in the field, trying to deduce important characteristics of what might actually mold a leader to take charge of organizations, not only in the Ministry of Health, but indeed in any organization that strives to enhance and develop their managerial capabilities in these very important frontiers of leadership and decision making.
The ceremony reviewed the idea and phases of the Leadership and Decision-Making book, LDM++. The book reflects a series of scientific achievements of the ministry that focused on the human factor that was and still contributing to upgrade the health services at a time when the health systems are facing unusual challenges.
Leadership and decision-making in Ministry of Health is very important. Healthcare organizations are among the most complex organizations. So this project actually will benefit both the current leaders who are in leadership positions as well as the young leaders. There are certain competences that have been identified in this project that will help know exactly what should leaders know in order to help them to perform their role in a very good way.
It's been done in Oman by Omanis, and also it has been authenticated by a lot of academic institutions from the United States. We are very proud of it, but the work never stopped. Now the work of improving the healthcare services will begin from now by conducting a lot of workshops and also by selecting suitable leaders and managers to lead the healthcare institutions.
The idea of this project is based on submitting unprecedented, genuine and applicable suggestions and initiatives that contributing to improving working methods and the administrative and financial processes according to a number of requirements and basics. This book, with its 18 chapters of scientific materials written by a group of professionals, committed researchers, it indeed consists of a wise guidance of Minister of Health leadership to embark on a journey of exploring best practices to drive the healthcare sector to its level best. Abdullah bin Ahmed al-Rubai, Sultanate of Oman Television, Muscat. And now, to learn more on these projects, the Leadership and Decision-Making book and the privileged initiatives of the Annual Leadership Forum, we have with us live online is Dr. Majid bin Rashid al-Miqbali. Dr. Majid, thank you first of all for being with us. Can you hear me?
Yes, of course, Mr. Abdul. Thank you so much, and I'm very pleased to be here.
Thank you, thank you. Now, Dr. Majid, first, can you tell us how did the idea of Leadership and Decision-Making project originated at the Ministry of Health?
You know, the health sector is one of the sectors that are very complicated, and it dictates the need for young and potential leaders to be given the roles and responsibilities within the huge departments within the health sector. And at the Ministry of Health, this has been there all the time, and for the last, I would say, 10 years, we are lucky to have people who believed in the idea of developing leaders, Omani leaders, and to give them the tools and equip them with the skills and knowledge so they take the responsibility whenever is needed. In addition to that, the WHO, the World Health Organization, has identified leadership as one of the most important 6 pillars of building any health, I would say, organization. And considering that leadership is one of them, the work has started, and we didn't want at the Ministry of Health to start as any other project with very, I would say, unscientific way of doing it. So we decided to conduct a research study, and that study was conducted by Omanis, and it used very, I would say, original tools that assisted us in identifying the competences of leadership within the culture of health in Oman. And as I heard in the report, and as it has been documented in the study and in the book, whatever we found in the study could be replicated in any health sector, in any sector in Oman, not necessarily in the health sector.
Very proud of these young Omanis to have accomplished what they have worked on this particular project. Now, what changes would make by reading this particular book in preparing healthcare leaders, in your opinion?
After we have completed the study, and we asked ourselves what's next. We didn't want that beautiful and good work to be put on the shelf, and that's why we decided to write chapters, and those chapters actually reflect the 36 competencies we found in the study. And those 36 competencies were put in a chapter format in which we answered so many questions that any healthcare leader within the Ministry of Health or within the health sector in Oman would need to train and develop, would find it useful. We are very confident that a lot of insights and understandings will be gained from reading the study, and also the 36 leadership competences which are stated in the study that were combined and presented in the 18 chapters would be very useful, because they have been also reviewed by local and international experts. And that expertise was really useful, because it told us also of what's happening in the world in this context. We are very optimistic that the Ministry of Health institutions, as well as all other sectors in Oman, would use this book, because it's local, number one, and number two, it's based on a scientific evidence, and number three, the language used with the exercises put in the book would facilitate training, would facilitate learning, and would facilitate a lot of insights and tools for anybody interested in developing leadership, either in himself or in the organization.
Wonderful. Now, one of the chapters describes succession planning. How important is that for the Ministry of Health at this particular time?
You know, this time is really important, because as everybody knows, the whole country is facing a lot of changes, in which a lot of leaders have retired, and alhamdulillah, we are ready now, because the work started 8 years ago. The succession planning chapter, it tells the institutions within the Ministry of Health of how they should be ready in developing leaders, in identifying leaders, what are the criteria to select, and once selected, what could be done for them to be ready, what kind of tools to be given, and what are the best practices within the world in developing and I would say equipping the leaders and taking the roles and being so ready to take the role with less, I would say, consequences.
Now, finally,
so the chapter would help everybody to be at the right place and do good for the institution and for himself.
Now, finally, what would you like to tell the young leaders what to do at this particular time for them?
Well, to be patient. I would say the journey is long, and what you need to do is to be patient, because every day you learn something new. Don't feel that you know everything. You really need to listen to everybody and listen to your customers, listen to your patients, and try to understand things from the roots. Don't go superficial at all. Those people who worked before us and have done a lot of good things in the country, they are treasures, and they have to be maintained and retained. Whenever you need any help, you go and find them. Reading is very important. Don't wait. And by doing so, I'm sure success will be ahead.
Excellent. Of course, the 18 chapters of the book will no doubt empower those on the leadership in the health sector, as well as leaders in other various government and private sectors. Dr. Majid, once again, thank you for being with us. We wish to one and all the very best.
My pleasure.
Thank you. That was Dr. Majid bin Rashid Al Miqbali, head of the Office of His Excellency, the Minister of Health. And yet to come in our news bulletin, Oman Chamber of Commerce and Industry organizes a symposium on insurance protection for fishermen and fishing vessels and boats. Welcome back to the news from the Sultanate of Oman television. The Minister of Education is working in cooperation with the state's bodies concerned to disseminate the culture of cybersecurity in order to combat problems resulted from misuses of modern technology means, especially with the expansion of online education. The ministry is organizing a number of technical workshops in the field of information security. These workshops target teaching staff, students and parents. The cybersecurity program, which is being implemented by the ministry, aims to raise awareness about the subjects among 1,000 male and female students. Reviewing views on issues of common concern between the Sultanate and the United Kingdom topped the discussions when His Excellency Mohammed bin Nasser Al Rasmi, Secretary of the Ministry of Defence, received Admiral Anthony Radakin, the British Chief of Naval Staff. They also exchanged cordial talks. Rear Admiral Abdullah bin Khamis Al-Raisi, Commander of Royal Navy of Oman, received Admiral Tony Radakin, Chief of Staff of the British Navy. During the meeting, they discussed naval matters between the two countries. The guest also got acquainted with the tasks and roles played by the Maritime Security Center in management of the security operations, in addition to search and rescue operations, as well as preserving the marine environment. Oman Chamber of Commerce and Industry organized a symposium on insurance protection for fishermen and fishing vessels and boats. More details in the following report.
Implementing the insurance protection policy for fishermen and fishing vessels and boats, and the mechanism to protect the fisheries industry in accordance with the law of fisheries and protection of living aquatic resources, topped the discussions of the symposium on insurance protection for fishermen and fishing vessels and boats, organized by Oman Chamber of Commerce and Industry.
We believe that this conference is going to come to a really understanding to all the fishermen what's to be done about it, because the insurance is a very necessity in this life, and we believe that it is going to help them to cover under risk in future, because you never know whenever the storm and anything comes, and it may be lose their life, they may lose their properties and other things.
The discussions of the symposium called on insurance companies operating in the Sultanate through the Omani Insurance Association to review and discuss the unified insurance policy for fishing boats, vessels and equipment, and fishermen personal accident injuries. The symposium also discussed protecting the lives and assets of fishermen from accidents resulting from natural disasters and accidents taking place in the sea and ocean.
The most important element of the policy is protecting the fisherman, his assets, His assets is the boat, machinery, and also the stock in the boat, and also his personal life. So the policy covers all these items up to a certain limit. But the question is, the finance and the leasing companies has to persuade the fisherman that he must insure before applying for the loan.
The symposium on insurance protection for fishermen and fishing vessels and boats also highlighted protecting the interests of financing companies through activating insurance for fishing boats and vessels, besides creating job opportunities in the fishing profession. The working papers presented in the symposium shed light on fostering insurance awareness among fishermen, developing insurance premiums, and boosting the sector's contribution to the GDP. Salih bin Khalfan al-Rahbi, Sultanate of Oman Television, Muscat.
The positive cooperation represented by the Ministry of Health Department of Public Relations and Communication and various media has been one of the effective tools in delivering messages to the public to combat COVID-19. More details in this report. Being the information outlet that outreach the community, the Public Relations and Communication Department of the Ministry of Health, like other departments of the ministry, has actively taken part in combating and mitigating the spread of the coronavirus, COVID-19. The department is publishing news, data and broadcasting awareness materials prepared by the Ministry of Health, Health Education and Awareness Programs Department. In addition, the contact center that is affiliated with the department is connecting the ministry as a whole and the community's various groups. Since the first meeting on COVID-19, the department has continued to exhibit its dynamic media role in publishing press materials that varied according to the developments of global situation with the corresponding local interest. The department, by working with the media cell of the Supreme Committee tasked with handling the developments resulting from the spread of the coronavirus, along with the Oman's Government Communications Center GC, represent the first source of the broadcasted news throughout its virtual channels at the e-health portal as well as its social media sites. Furthermore, the department has a major role in coordination process for TV and radio reports and programs on official and private radio and channels, both in Arabic and English languages. The department, in coordination with the Ministry of Health, Education and Awareness Programs, provides TV and radio producers with the required data and information needed for their reports and programs. The positive cooperation between the Minister of Health, represented by the Department of Public Relations and Communication and various media, is an effective tool in delivering its messages to the public. The cooperation is achieved through news reports and the data issued by the concerned authorities in the ministry. The process of receiving and preparing the news and educational materials to be posted to various media and communication platforms are collectively involving department section of media and translation that include media specialists, photographers and translators, assisted by other colleagues in the department concerned with design and e-media, e-health portal and ministry's accounts in the social media. Moreover, the department plays a vital role in spotting and refuting rumors, particularly on the social media platforms in collaboration with the Oman GC. The effective partnership is characterized in standing against rumors and false news, as well as working harmonically to clarify any ambiguity to the public and correct some misconceptions about the disease and methods of prevention. Abdullah bin Ahmed al-Rubai, Sultanate of Oman Television, Muscat. And now, all the way to Britain. Britain began rolling out the COVID-19 vaccine developed by Pfizer and BioNTech today, the first Western country to start vaccinating its general population in what was hailed as a decisive watershed in defeating the coronavirus.
The first shot came today at one of a network of hospital hubs around the country where the initial phase of the UK program will be rolled out on what has been dubbed V-Day. Public health officials have asked the public to be patient because only those who are most at risk from COVID-19 will be vaccinated in the early stages. Margaret Keenan, a 90-year-old grandmother, was the first person in the world to receive the Pfizer COVID-19 vaccine shot outside of a trial. An early riser, Keenan received the vaccine at her local hospital in Coventry, central England this morning, a week before she turns 91. Hospital workers burst into applause as she became the first person in the world to receive the Pfizer COVID-19 vaccine. Meanwhile, British Prime Minister Boris Johnson said he would not be among the first people to receive the Pfizer COVID-19 vaccine, as he wasn't in the priority group, as the UK began vaccinations today. Johnson met patients who were receiving the vaccine at a London hospital as Britain became the first Western country to start immunising its general population. Britain is the worst hit European country from COVID-19, with more than 61,000 deaths. Johnson hopes to turn the tide against the disease by rolling out the Pfizer-BioNTech vaccine before the United States or European Union. Britain has ordered 40 million doses of the Pfizer-BioNTech shot. As each person requires 2 doses, that's enough to vaccinate 20 million people in the country of 67 million. About 800,000 doses are expected to be available within the first week, with care home residents and carers, the over 80s and some health service workers the top priority to get them.
From Britain to globally, the novel coronavirus has killed more than 1.54 million people since the outbreak emerged in China last December. Around 67.54 million cases of coronavirus have been registered. Of these, at least 42.3 million are now considered recovered. Yesterday, 7,992 new deaths and 514,050 new cases were recorded worldwide. The United States is the worst affected country with 283,746 deaths after the U.S. The hardest hit countries are Brazil with 177,317 deaths, India 140,958, Mexico 110,074, and the United Kingdom with 61,434 deaths. Europe recorded 450,176 deaths, Asia 201,034, the Middle East 82,370, and Africa 54,111 deaths. You're watching the Sultanate of Oman television, and to end this news bulletin, here are the main points once again. His Majesty Sultan Haytham bin Tariq sends a cabal of condolences to His Highness the Emir of the State of Kuwait on the death of Sheikh Nasser Fahd Sabah and Nasser al-Sabah. And the National Oncology Center of the Royal Hospital launches the technique of microscopic radiosurgery to treat cancers. And with that, we do conclude this news bulletin brought to you live from this news center of the Sultanate of Oman television. From the entire news team and myself, we thank you for joining us, wish you a pleasant evening, and good night to all of you.